So yesterday I presented an abstract of ABT-199, which is now called Venetoclax, in combination with either the hypomethylating agents azacitidine or decitabine in the upfront setting for elderly AML patients over the age of 65, not otherwise eligible for standard therapy. And in those patients, we've treated 34 to date. 24 of them have gone on to obtain either a CR or a CR with incomplete count recovery, and an additional 2 have had a partial remission defined by the IWG full count recovery, decrease in bone marrow blasts. And what's been really interesting about this study is how quickly we've seen responses. So with standard hypomethylating agent therapy for AML patients, it typically takes about 4 to 6 cycles to see a response. And I think one of the most interesting things about this study is how quickly we've seen responses. And within 1 to 2 cycles, a median time to response of less than 30 days, by the time of that first end of cycle 1 bone marrow. So that's been really encouraging. This was a high-risk population, elderly. The median age was 72. Many patients with a performance status of 1 or 2, a quarter of the patients had performance status of 2, which is a little bit higher than you would expect in most of the clinical trials moving forward, and higher risk features such as adverse cytogenetics in a lot of patients. So it's an early study, with 34 patients to date. Certainly this isn't something that we are going to be making any game-changing decisions on yet, but it's been very promising so far, so we're excited to be part of it.